Thank you for joining us for this episode of Comply on the Fly with M3 and Karen B. Comply on the Fly is your trusted weekly resource for reliable insight and quick answers on common employee benefits compliance questions. Please note, this podcast and the contents herein do not constitute legal advice. Seek the advice of counsel for any employee benefits compliance-related guidance or strategy.
Hello everyone, I'm Karen B. And the Comply on the Fly question of the week is, can I continue to offer COVID-19 testing and treatment under my HSA or health savings account compatible High Deductible Health Plan or HDHP now that the national emergency and public health emergency is over? This question was recently answered in guidance issued by the IRS in Notice 2023-37, which modifies prior guidance allowing for HSA-compatible HDHPs to pay for COVID-19 testing and treatment before the annual deductible is met. As you may recall, these high-deductible health plans are generally not permitted to provide benefits until the annual minimum deductible is satisfied. However, benefits that qualify as preventive care can be provided pre-deductible. By definition, preventive care would include services required by the Affordable Care Act, or ACA, as well as services determined by any guidance issued by the Department of Treasury Department, or IRS. During the COVID-19 pandemic, the Treasury Department and IRS did issue guidance in IRS Notice 2020-15 that allowed high-deductible health plans to provide medical care services and items related to the testing and treatment of COVID-19 prior to the satisfaction of the minimum deductible without affecting HSA eligibility. With the end of the COVID-19 national emergency and public health emergency in spring 2023, the Treasury Department and IRS have determined that the relief provided for these COVID-19 services in relation to high-deductible health plans will end for plan years ending on or before December 31st, 2024. After that date, plans will no longer be able to provide benefits for COVID-19 testing and treatment without applying the deductible. The other way COVID-19 tests and treatments could be covered is if they are considered preventive care as required by the ACA. Currently, COVID-19 testing and treatment benefits do not fall under the preventive care safe harbor for pre-deductible treatment. However, if at a later date, the United States Preventive Services Task Force, or USPSTF, were to determine that COVID-19 testing is recommended with an A or B rating, then the services would be treated as preventive care and pre-deductible coverage would be allowed under a qualified high-deductible health plan. So, if you have an HSA-compatible high-deductible health plan, understand that the coverage of COVID-19 testing and treatments will be subject to deductible after the plan year that ends in 2024. For instance, if you have a July 1 plan year, this first dollar coverage can continue until July of 2024. Calendar year plans would be able to cover until December 31st of 2024. And that is your Comply on the Fly question of the week. Thanks for tuning in.
What's on your mind? If you have a pressing compliance question, send it to askkarenb@m3ins.com. We'll do our best to cover it in an upcoming episode. You can now follow and subscribe to Comply on the Fly on Spotify, iTunes, and Google Podcasts. Make sure to tune in next week and encourage others to join us.